dysautonomia in general describes not regulating the autonomic nervous system properly. And then when we actually look to diagnose it, what's happening when we check orthostatic vitals or get a patient on the tilt table, there'll be different things happening with the heart rate or the blood pressure when people change position, which can give us better information about how we actually subcategorize dysautonomias into some of the common conditions are POTS, which is postural orthostatic tachycardia syndrome. We have vasovagal syncope or neurocardiogenic syncope. We have orthostatic hypotension, and there's several other conditions that fall under there that are a little less common or might create more primary types of dysautonomia.
Hey guys, welcome back to another episode of What Did the Patient Say with Drs. Dana and Lauren Brindisi, sisters and owners of Carolina Functional Neurology Center. We are bringing you inside information from real conversations we have with patients on a daily basis. We get asked the same questions and want to spread the truth on health and healing because we believe everyone deserves to know the answers.
Hi, welcome to another episode of What Did the Patient Say? This month, we're kicking off Dysautonomia Awareness Month. So for this episode, Dr. Lauren and I are going to talk about dysautonomia. A lot of you that follow us, you've already been diagnosed and you're either already going through treatment or you're waiting for treatment. But there's also a lot of you that maybe have symptoms that mimic dysautonomia, or you have dysautonomia and you might not know it, or you're waiting to get diagnosed. So for this first episode of October, we're going to answer some generalized questions for those of you that maybe aren't sure what it is that you're dealing with, and maybe we can help you get to the right place or have the right conversation with your doctor. And then we're also going to talk about a couple of questions of, those of you that have been dealing with this for a long time, maybe what are some things that you can do, or, is there hope out there? So the first question we're going to answer is, what is dysautonomia? So Dr. Lauren, take it away.
Yeah, so generally dysautonomia is considered an umbrella term in terms of a diagnosis. There are tons of conditions that actually fall under that. So there's subcategories to dysautonomia. But dysautonomia in general describes not regulating the autonomic nervous system properly. And then when we actually look to diagnose it, what's happening when we check orthostatic vitals or get a patient on the tilt table, there'll be different things happening with the heart rate or the blood pressure when people change position, which can give us better information about how we actually subcategorize dysautonomias into some of the common conditions are POTS, which is postural orthostatic tachycardia syndrome. We have vasovagal syncope or neurocardiogenic syncope. We have orthostatic hypotension, and there's several other conditions that fall under there that are a little less common or might create more primary types of dysautonomia. Next question is going to be, why am I experiencing so many different symptoms?
This is a great question. So a lot of times when people come into us, they've got loads of symptoms, right? Some of them might be neurological, some of them might be cardiac, some of them might be GI, some of them might be just weird symptoms that you're like, I don't know if this is related to my dysautonomia, and I know that a lot of you guys are on these different Facebook groups and, different things, and you guys throw out all of these questions, right? Like, I have this, does anybody else have that? So most of the time, the answer is probably yes. So for those of you that maybe haven't had a diagnosis, or maybe you haven't had anyone to bounce ideas off of or talk about, a lot of these things stem from the autonomic dysfunction for a couple reasons. One, generally speaking, when you have dysautonomia, you're not moving adequate amounts of blood through your body, which means that you're not moving adequate amounts of oxygen. You need to move your blood and dump oxygen out at your tissues, at your organs, into your brain. So when you have dysautonomia, you can really have symptoms that stem from anywhere in your body, right? Because if you're not oxygenating that tissue, that organ, your brain, those nerves, right, at a cellular level, it can cause a lot of different problems. The other interesting part about the autonomic nervous system is that, and some of you may know this and some of you may not, but there is an extension of your autonomic nervous system. And we talk in depth, in other episodes and on our blog posts and things like that about the extension of the autonomic nervous system, which is your endocrine system or your hormone control and your immune system. These parts of your body or these other systems in your body are connected to your autonomics through a part of your brain called your hypothalamus. So when we kind of go through, all right, this is the autonomic nervous system, but now we know that that part of your brain can impact these other systems in your body. Now we're talking hormone dysregulation, right? So in women, right, do you have crazy things that happen around your cycle? Do you have dysmenorrhea and you don't have a cycle? And there's so many other things that we could talk about, but we want to try and keep this simple for today. And then we're talking about immune function, right? Are you the person that, someone sneezes next to you and all of a sudden you are in bed for 3 days and super sick? Or do you have also, in addition to your POTS, some sort of autoimmune condition that's maybe started to come to life since you've gotten diagnosed? Or maybe everything's happening at the same time and you're kind of thinking, oh my gosh, what's happening? Now I have all of these other issues, when in reality, they're probably not all separate. They're all connected to each other, which is how people end up with all of these, what seem to be random symptoms. But when you look at the body as a whole, they are certainly not random. And a lot of times the underlying issue is the autonomic dysfunction. Okay, next question. Dr. Lauren, what causes dysautonomia?
So that was a great kind of intro into segueing and understanding that there's a ton of different things that could be playing a role in contributing to somebody developing some type of dysautonomia. Definitely we're looking at, possibly genetic components. Some newer research is in some cases there may be some autoimmune components. What we see a lot in our offices is trauma can play a role. So physical and emotional trauma. We see patients who have had concussions. We have patients who have had, a variety of emotional traumas, maybe related to, some type of PTSD that's affecting their nervous system. Car accidents, those types of things can create autonomic dysfunction. The other aspects that we see are patients who maybe have other underlying diagnoses related maybe to their endocrine system. Hashimoto's, sometimes we'll see some autonomic dysfunction correlated with that. We do find patients can develop POTS after pregnancy. That's another one. And then the immune system is a big one. And especially with COVID going on, that's really coming to light. But even before COVID, we were treating autonomic conditions after a wide variety of infectious processes. So we see it secondary to chronic Lyme disease, mold toxicity, Epstein-Barr virus, the flu, now COVID. So there's a whole bunch of components that could be playing a role in terms of what's going on with a specific patient, even though they present with similar symptoms. So 2 patients come in with POTS. The big question for us is, okay, what systems are affected, and maybe where can we look back in the history and peel back the layers to figure out, can we understand where this started from and what system is maybe initiating this? And if you are more familiar with POTS, you may already know or have been diagnosed with a subcategory of POTS. That's starting to unfold in terms of the more that we understand about POTS, the different subcategories even within that are coming to light. And that gives us a lot of good information that could help us understand where your dysautonomia is coming from.
Yeah, and we did have a question the other day, so I just wanted to say this real quick, is a lot of times we say POTS, and I kind of lump our IST patients in with that diagnosis, even though they are not exactly the same, and there definitely are some differences, but sometimes I guess I just don't mention the IST, which is inappropriate sinus tachycardia, as much as we do talk about POTS. But I want you to know, you guys out there that have been diagnosed with IST or that you think you have it, we're talking to you too, because we see it all the time. And maybe we just don't mention it. And we need to be kind of more aware of that, because some people, that is their official diagnosis with maybe not anything else attached to it. And we're aware and we hear you. And some of these things that apply to POTS are very, very common in IST. So I just want to put that out there.
And that kind of goes for all dysautonomias, right? They're all part of the same family. And the autonomic system is not being regulated properly. There might just be different components not being regulated, and there might be different causes. So that's where when our patients come in, this is really not a cookie cutter treatment plan. There's no way to do that in these types of conditions, because all of them in themselves are kind of like a spectrum of diagnoses, because one person could come in with POTS, and the next person could, or two people come in with IST, or two people come in with vasovagal syncope. That doesn't mean they're getting the same treatment, even though they have the same diagnosis.
Yeah.
So the next question is going to be, are there any lifestyle changes I can make to help?
And this is an interesting question, because I feel like those of you that have symptoms or already have a diagnosis, a lot of times you're forced to make lifestyle changes because of what you're dealing with. But many of you know, and those of you who have been diagnosed, you've been told almost always the same things. Those of you that don't know and you think that you have a dysautonomia, some of the things, and again, go see your doctor. We're not here to prescribe people medical advice that we've never evaluated, but kind of in general terms, what we see very often is, drink more fluids, increase your electrolytes, compression stockings or leggings or things like that usually are helpful. Weighted blankets for those of you that are having trouble sleeping. Not letting your temperature get too out of control. So if you live somewhere warm, like we do here in North Carolina, a lot of our POTS patients feel better, in the air conditioning and things like that. Understanding the capacity for your body to handle any sort of stimulation. So a lot of people will have good days and bad days. And when you have a good day, a lot of people will be like, 0 to 100, especially when this is new to you. And so I always encourage patients, listen, you've got to understand that if you push yourself too hard one day, even though you're feeling good, you may pay for that for days or weeks after. And when this is new to you, you might not realize that. So just kind of honing, kind of your day-to-day activities in so that you can do the things that you need to do if you can. I know for some of you, that's not even possible, but if you can, maybe you feel good enough, maybe you clean the bathroom, maybe you don't clean the whole 5-bedroom, 4-bath home in one day because you have a good day. I'm trying to think of if any other kind of generic things, but we are going to be touching more on this every single day of October. So stay tuned, because we're going to be answering these other individual questions in a lot more detail.
Yeah, I got one more that I think is useful. Our blood volume in general is lowest in the morning because we have been sleeping all night and haven't been consuming any fluids. So allow yourself time in the morning to get up slowly, to get moving slower. Usually the morning is the toughest for most of our patients.
Drink a big glass of water before your feet even hit the floor.
Yeah, exactly. And just take your time. And that can go a long way.
Yeah. And we usually say for our patients, because everyone asks how much water should I drink? And I always tell people there's no substitute for plain water. So whether you're putting electrolytes in it, you're drinking tea, you got Propel, whatever it is, plain water, half of your body weight in ounces.
Yeah.
Cool. All right. Dr. Lauren, how does Carolina Functional Neurology Center treat dysautonomias?
There's a lot of things I could say right now, so I'm going to keep it a little bit short. But after our initial exam, which gives us, a full comprehensive view of all these different systems that we talked about, we'll look objectively at your autonomic system, but also all different parts of your brain function. We'll run some labs. If we think, any specialty tests are warranted, we'll get those done. And then we devise a treatment plan that's individualized to really optimize your physiology, not treat your diagnosis. So that comes with a lot of time and background digging into what's going on with each individual patient. Most of our patients in some capacity are coming in for active neurological rehab. One of the cool things that we do with a lot, but not all of our dysautonomia patients would be, we do tilt table therapy or orthostatic retraining. So tilt table therapy is passive. We actually put patients on the tilt table. We start them at 0. And then we're monitoring their heart rate as they change position. We want to
see your symptoms, because for those of you that have had tilt table tests, I know you probably just got tachycardic hearing that, thinking that somebody would do that for rehab. But across the board,
looks very different.
It's very different, and we're monitoring your vitals and your symptoms all at the same time. So no one is really having an issue with this type of therapy. I just wanted to interject that, because people get very nervous when you talk to them about the tilt table.
Yeah, it's not, it's really boring, to be honest, probably comparatively. Our whole goal is to keep you below your threshold. So we're bringing you up slow. And then what we want to see is where that breakdown in the autonomic system comes in, basically what degree. And then we want to lower you below that threshold, and we'll do a whole variety of therapies there. Actively, we'll do other versions where people are changing position, maybe lying, maybe seated, maybe standing. And again, it's coupled with a variety of different neurological rehab methods. The other side of this is more the functional medicine side, in which we'll be analyzing labs, and we'll do things for you at home, usually related to things like supplementation, diet, lifestyle changes, things like that. Those are kind of the main 2 categories. And again, we'll probably talk in more detail this month about specifics in terms of what we do. But generally, the main points are, it's a customizable, individualized treatment plan, and we do a variety of things. But the unique thing that we really do as functional neurologists is going to be coming in for actual active neurological rehab.
Yes. And what we're doing is creating neuroplasticity, changing their brain function, meaning changing their autonomic nervous system, so that it can be more effective and efficient, and reduce the symptoms that they have.
Yeah. I always say to patients, I'm like, it's just like you go to the gym and you work out your muscles, they get bigger and stronger and more defined. Neuroplasticity allows us to do something very similar in the brain, where when we activate it in very specific ways, we're able to make change and grow new and better and more efficient connections in the brain. Your brain's getting a 6-pack. So last one is going to be, will I ever feel better?
Yes, 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 and yes. If you guys have been following us for any period of time on our social media platforms, or here, with these, what did the patient say? You had to have come across or read several of our patient testimonials and success stories about how we treat dysautonomias, and what our patients have accomplished throughout their rehab, kind of where they started, what did their symptoms look like, what symptoms do they see have resolved or lessened, and then what objective findings that we're measuring in heart rate and vitals, and different things like that. We see great hope for dysautonomia now and in the future, because we see it every single day where patients are getting better. And there is not a, one treatment that works best for everybody. And almost all of our dysautonomia patients that come in to see us for neurological rehab are being co-managed by their cardiologist or their medical neurologist or their primary care, because you've got to have a team. And Dr. Lauren and I believe that wholeheartedly, and we work very hard to have connections with these other providers for you guys so that we can all collaborate together. And the cool thing is that we have a lot of patients that come into us that are on their medications. Maybe they can reduce the dose that they need, or maybe they don't even need that medication anymore, because we've been able to create enough change in the brain that they can function at the same capacity, or hopefully a better capacity, without the medication. But we manage that with your provider, so it's not one or the other. And we see it all day long. So for those of you that are out there that feel like there's no hope, or you've already done a lot of things that maybe haven't helped as much as you would want, or even at all, please, please, please find a functional neurologist who knows about autonomic dysfunction, that can help, because it works and we do it all the time. We see patients from all over the country. We see now patients from all over the world working on these dysautonomias. So if that's you and you need some guidance, or you're looking for treatment, please do not hesitate to reach out to us. Go to our website, carolinafnc.com. We have a dysautonomia program page up there. We have patient testimonials, we have case studies, we have blog posts up there. Follow us on Instagram, on Facebook, on YouTube. There's a lot of information out there, but we offer complimentary consultations so that you guys can speak with us prior to making a commitment of coming in for a new patient exam, and talk to us specifically about your individual case and your individual needs. So you will feel better. You just got to get yourself to the right place, and the right people that know the intricacies of what the heck is going on with your brain, but also all of these other things that we've talked about today. So, as always, send us your comments. These videos are being driven by you guys. As you can see, Dr. Lauren and I both have our stickers on today. Mine says, "The issue isn't my heart, it's my brain." And then Lauren says,
anything is possible.
So we are doing a collaboration with the Humorous Med, and you can find them on Instagram, and we're going to be rolling out some cool information for you guys, and hopefully these stickers and maybe some other stuff are going to be able to help some of you get treatment in the future. So stay tuned.
All right, have a good day.
Bye. Happy Dysautonomia Awareness Month.
Yeah. Bye.